Well, the reason we started CodeBlueNow is that our healthcare reform debate it's failed. It's either single payer or health savings accounts. And if you want to start a war zone, just say single payer, and then people, the health savings account people will be there, and everybody gets distracted with the war rather than trying to do what we want to do, and which is solve a problem. We feel very strongly at CodeBlueNow that the people's voice needs to be heard. And so one of the tools that we have is what we call our CodeBlueNow Pulse. It's an online survey tool. It's also available in hard copy, so it's not restricted to people who have computers. But what it enables us to do is tell us what people feel or what's important to them in some key areas about how to pay for the system, what kind of coverage they want, what kind of providers they want, and just kind of get a general feel of what's important to them. We've just finished our first CodeBlueNow Pulse in Iowa. We want people to go to our website and take the CodeBlueNow Pulse, because the more people we can get in there and have the volume, the more we can point to the candidates and see this is what the people want. And so for the next, between now and the mid to end of 2008, we want to have as many people take our CodeBlueNow Pulse as possible. So we will have good, robust data that we can show the candidates and policy officials this is what the people want. And then after that, we're going to be working on how do we pay for it, how do we finance it, how do we manage it, and build consensus on those. So we want to find the common ground and build consensus and bring the people along and the policy officials along. CodeBlueNow is doing what we're doing because, first of all, if you look around, almost all the healthcare reform groups out there have a plan. They have a single payer solution or they have a health savings account solution, and those two groups don't listen to or learn from each other. And most of what the people want is somewhere in between, and we are really trying to give the people the voice. That's why we have the Pulse, so we can see how they feel about some key issues. We're partnering with other nonpartisan, nonprofit organizations who have large membership bases, because we as an organization, it takes a long time to knock on doors and round up members, but if we work with groups that are already out there, like the League of Women Voters, like United Way, like the Grange and the newspaper publishers associations, all those people care about health care and haven't had a way to have a voice. And so we're trying to become a forum and a funnel for their voices to be heard and get enough people so that we can finally take it to the elected officials and politicians and say, this is what we want, and by the way, we vote. Okay, so what can you as an American voter do? You can get involved, and then you can do just a few things, or you can do a lot of things. You can go to our website, you can download a copy of our declaration, sign it and send it to your congressman. Where I think we'll be able to get it online soon, so that you can just click here and send our declaration on and tell the Congress this is what you want. You can write a letter to the editor. You can take our Pulse and have your friends take the Pulse, and friends and family. Get as many people as you know to take our Pulse so that we'll have data. And after a while, it's only thousands now, but when it become hundreds of thousands and millions, people will pay attention. And that's the only way we're going to make a difference. You can't leave it to the candidates. I mean, who's funding all their races? The insurance companies, the drug companies, the medical device companies. And anybody can give candidates money, but it's only you and I who can give them their job. If we can win World War II by fighting on two fronts, if we can get a person to the moon, if we can build a highway infrastructure across this country, if we can have the civil rights movement and the women's rights movement, we could certainly fix the healthcare system.